My name is Marilyn Clodfelder. I'm the Director of Medical Surgical Services. That includes the 3 med-surg nursing units and the rehab unit. I am a registered nurse. I have been employed at Provena Covenant Medical Center going on my 34th year. So I've kind of grown up here. My entire nursing career has been spent here, and I also went through nursing school, my bachelor's degree and my master's degree, all while employed here at Provena Covenant Medical Center. When I started at Provena Covenant Medical Center, I worked in the dietary department. From there I went to the business office in clerical positions, to the engineering office, a clerical position, went through nursing school, became a staff nurse, worked as a staff nurse for several years on the surgical unit. Then I became a care coordinator, which is a person who does a lot of discharge planning, looking at clinical issues with patients. I did that for a couple of years, became an assistant director, which is basically the same position that we have as managers now, of the orthopedic unit. From that position, I became the director of med-surg, which was a couple of units. Opened up a 3rd unit and then assumed the leadership of the rehab unit a year ago. So I've seen a lot of change. I've seen the style of nursing change from primary nursing, 1 nurse to 4 patients doing everything, to a more team type of nursing where we used a lot of healthcare techs, and then back to more of a modified approach to both, where the nurses have a patient assignment, but they have healthcare techs available for all of the ADL types of things on the nursing units, a lot of assistance. I think we have a real team environment. It takes all the players to take care of patients nowadays. It's fast-paced. Anywhere you go to work in nursing nowadays, patients are in the hospital because they're sick, and you're busy taking care of them. But it's a real quick-paced, friendly, fun environment. We enjoy what we do, and I think for the most part, I think everybody really works well together, whether it be just the nursing folks on the unit, but they also, we have therapy folks and radiology folks. We have people from dietary, from security. We really, it's a team effort to do everything that needs to be done. We see constant changes with technology. We're becoming more and more technological savvy with the things that we do and the things that are coming forward. All of the computerized documentation, and then voice recognition documentation, and all of the things that are going to be coming down the pipe that really are going to help the nurse get the things done that she has to do so she has more time at the bedside. Patient care nursing it's a busy place, and we need to have technology to help us so that we've got the time we need to spend at the bedside. One of the things that I always tell any new grad when I interview them for a job is that it's scary when you've gone through school and you've passed boards, and now you're going to start working as a nurse. It's really kind of a scary transition, and the thing I always say is that nursing school gave you the tools that you need to become a good nurse. You have to work as a nurse to learn nursing, and the more questions you ask, the better off you'll be. Because it's experience. There's just so much about it that is experience, and so don't feel down on yourself when you have to ask questions, because if you really watch your peers and watch the seasoned nurses around you, they're constantly asking questions. They're validating things with the younger nurses, with the nurses that are just as seasoned as they are, because that's what this profession is all about. It's about working together and making the right decision for the patient.